Nasal bone fracture. We have a pair of nasal bones that's in the upper part of the nose. The lower part is supported by cartilage. Like how you see in this picture, one nasal bone here, one on the other side. Likewise in this picture, one on this side, one on this side. So we are going to discuss about nasal bone fracture, not about facial bone fractures, only nasal bone fracture. This usually results because of an assault or any type of sports injury, or it can be a fall or road traffic accident. The patient presents with any of these followed by nasal bleed and nasal obstruction. On examination, the whole nasal framework, external nasal framework will be swollen up. Along with that, there will be discoloration around the eye. So we cannot make out the shape of the nose, and sometimes there will be change of the shape of the nose too. On examination, the best way to diagnose a nasal bone fracture is by palpation, by touching the part, the nasal bone. So you should be very careful here, because when you touch, it's going to be painful. So when you touch the part, we can hear a small crepitus sound because the bone is mobile there. So it confirms, the crepitus sounds confirms the presence of bone fracture. That is the best examination. That's the best way to diagnose. And we have to see the inside of the nose also, nasal cavity, because we have to see whether the septum or the partition between both the nasal cavity has been pushed to one side or not. Likewise, is there any swelling in the partition? It means any blood collection inside the septum. In that case, it becomes an emergency. We need to take up the patient immediately for surgery to remove the blood from inside the nose. That we are not considering here. We'll come back to our topic, nasal bone fracture. So our examination part is done. So we have come to a diagnosis, there is a fracture. It can be reconfirmed with an X-ray. This is a plain X-ray of the nasal bone, of a normal nasal bone. You cannot find any fracture. Why I am showing you this? In the next picture, you can find a fractured displaced nasal bone. This is a fractured displaced fractured displaced nasal bone. Now, if there is any associated other nasal bone fracture, or we feel that we are missing something, there is other fractures too, we can get it confirmed with a CT scan. But normally, for an isolated nasal bone fracture, we do not need a CT scan. So this is a normal CT scan, and this is a CT scan which shows a nasal bone fracture. Then this is a CT scan. This is a CT scan 3D view, which shows the fracture of the nasal bone on the left side. Likewise, we have to document. We have to take a photograph of the external nasal framework too before doing any procedures. Now, when you visit to the first visit, soon after the trauma, whatever the trauma be, the patient comes to us. At that time, usually, even if it has been diagnosed as nasal bone fracture, we are not going to do anything. So what is the treatment going to be? We usually give a course of antibiotic, nasal drops and painkiller for a period of 5 to 7 days, and we ask them to come back after 5 to 7 days. Along with this, we request you to apply ice and warm compression alternatively. Cold compression for 3 to 4 minutes, followed by warm compression 3 to 4 minutes. Keep on doing it 3-4 times for 20 minutes. So every day you have to do the same thing 3 times daily till you come back to us. That is on the 5th to 7th day, usually on the 7th day. Why? Because we want the external nasal swelling to come down. Why? Because we want to see whether the external nasal framework is straight or not. If it is straight and there is a fracture, if it is not straight, it is bent to one side and there is a fracture, we had to do a surgery and realign it. When the patient presents with a nasal swelling, we cannot make out whether the external nasal framework is straight or not. So we are waiting for a period of 5 to 7 days so that the swelling comes down. and we are doing a contrast bath and giving all the medications because of that, and we are waiting for the same reason. Sometimes some of the patients following trauma, especially road traffic accident, along with the fracture, they may have a severe bleed. In case of severe bleed, we need to pack the nasal cavity and we may need to admit him for a day till we remove the pack. It is not very common, but this is also a possibility. Now, the timing for surgery, as I have mentioned, it is between 5 to 10 days. The patient comes back after 5 days and within 10 days. Why not later? Because the nasal bone usually it starts fusing by 3rd week and it completes its fusing and becomes stable by the 2nd month, 1 to 2 months. So we don't want to wait till that period. We want you to come back early. So when the patient comes back, let us categorize into 2 types. One is there's a fracture for sure, and one group without deformity, another group with deformity. So without deformity, even if there's a fracture, we are not going to do anything. The second category, there is a fracture and there is a deformity, but the patient is not willing. Again, we are not going to do anything. And the third category, there is a fracture, there is a deformity, the patient is ready to do the surgery. So what surgery we are going to do? And what is the technique are we going to use? So this can be done as an OPD procedure, or it can be done after admission. Take the patient to the operation theatre and under sedation we are going to do it. OPD procedure can be usually be done in males between the age of 20 to 50 if there is no other comorbid conditions. And if the patient, you feel the patient is cooperative. It can be done under local anesthesia in the OPD itself with the cooperation of the patient. In case the patient need to be admitted and to be taken to the OT, then we'll take a concern from you in which it will be written what the procedure we are going to do and what are the complications of the procedure. You go through that and you sign it. Along with that, you write your name legibly and put the date, and the doctor will countersign in that. Followed by, we'll do a few blood tests, and with the blood test and X-ray, everything is ready. We'll get a physician clearance. Followed by that, you'll meet an anesthetist, and anesthetist will give you clearance whether the patient is fit for surgery. Please do not forget, the doctors, we will not give you unrealistic expectations. We will not tell you that we'll make your nose perfectly straight. We can make it as much near to normal as possible. That is what is expected from us. So once this is done, we take the patient to the OT. We need a fasting of at least 4 hours before the patient be taken to the OT. And do not forget, after the surgery, there will be a splint outside which will be kept for 7 to 10 days. And there will be a nasal pack inside which will be kept for 1 day. So soon after the surgery, the anesthetist will ask you to breathe through the mouth and not to the nose, because this will be completely blocked for a day. Now, what are the indications for surgery? We take up the patient for surgery only if the outside external nasal framework is deviated. Just the presence of fracture alone is not an indication for surgery. Maybe it's an undisplaced fracture. It has to be displaced and there is deformity from outside. Then we take up the patient for surgery. Likewise, there may or may not be the movement of the septum to one side. This is the indication. So, like how I mentioned before, it can be done in an OPD procedure, or you need to be taken to the operation theatre where we do with an instrument. These are the 2 options. So, suppose you have been taken to the operation theatre. So that is called as closed reduction. That is means we are not opening it. It's a closed reduction of nasal bone fracture, and usually the operation per se, it takes less than 30 minutes. But inclusive of the anesthetist, staff nurse work all together, it takes about 1.5 hours altogether. So suppose you go from your room or the ward to the operation theatre by 9 o'clock, by 10:30 you are back to your room or to your ward. So once you are back in your room, for next 4 hours you are not going to drink anything or eat anything. And your position will be like this, propped up position. And this 4 hours waiting period, you will be giving fluids. After the 4 hours, you will be asked to take water first. If you are not vomiting, then you can start having liquid diet that day. And you will get antibiotic and painkiller too. The next day, subsequent next day morning, your nasal pack will be removed and nasal drops will be applied and you can go home. But do not forget, there is a splint which is kept outside. The splint, external splint will be removed only after 7 to 10 days. This is kept in place so that it stabilizes the bone there. Likewise, it reminds the patient and others that not to touch this area, to be extra cautious. And we are giving the bone time to heal properly so that you don't have a secondary trauma. So, on the time of discharge, you get an antibiotic course and a painkiller. Along with that, nasal drops which has to apply 3 drops 3 times daily for 5 days and review after 1 week for removal of the external nasal splint. So this is one of my patients which was done, the nasal bone reduction was done in the OPD itself. So this is before reduction, this is after reduction. He is very happy. Now, what are the complications of surgery? Soon after surgery you may bleed, or there is a possibility that there may be a persistence of nasal obstruction, or there is another possibility that you are not happy with the complete reduction. There is residual external framework deformity. This usually happens in sports trauma, where already there is an existing or previous history of nasal trauma and this is the second or third time you are doing it. In that case, the reduction may not be proper. This is a common cause for the third one. These are the complications. Now, what are the things to be avoided? Please do not forget, after the first visit, you will be asked to come back after 7 to 10 days. That time, please do not forget to revisit your doctor. He has asked you to come back after 7 to 10 days to decide whether the surgery has to be done or not. During the initial first visit, he has not yet decided whether the surgery to be done. So please do not forget, you have to go back to him after 7 to 10 days to decide whether the surgery has to be done or not. And this waiting period, try to avoid another household injury or any sort of other injury which affects the nose. And in case in this waiting period your nasal block increases and you are not able to breathe, go back to your doctor and don't wait for 7 days, because maybe there is a blood collection inside the partition which is called the septum, which needs urgent intervention. So if you go and have it, see the doctor, he will re-examine and he will confirm it is not any blood collection, it is related to the trauma, and if he says it is okay that you wait for 7 to 10 days, it's fine. Then you can go home, wait for 7 to 10 days and go and revisit him once again. And last piece of advice will be, when you have a discoloration around the eyes and sometimes blood collection inside the eyes too, you need to wait and just apply ice and warm compression. It takes time for the discoloration to become normal, but surely it will become normal. It takes time in the sense it may take a week or more than that. Just wait, it goes by itself. Now, some safety measures. Please do not forget to wear seat belts. Likewise, if you are in sports activity, follow the instructions of the coach properly, and if there is any safety equipments, do follow the instructions of the coach properly and wear it always whenever he says. Wear a helmet during motorcycle ride, and of course you have to avoid any sort of fight. So this is in short about nasal bone fracture. Thank you so much.